This is the latest model of the Forest chair.
Cool.
It's a radial arm, meaning you can go from right to left operators. And you just take this, for a left-handed person, you would put it over here. For a right-handed person, you put it over here.
Perfect.
So you don't swing this arm around 360 degrees.
Up and
You just
over.
bring it about 180 degrees. This arm does not have the extra of the screen.
The monitor on it, yeah.
The monitor
Yep.
on it, but it will.
Yep.
And then you can bring it over and show it to the patient, push it out of the way. And the light has an automatic sensor on it, so that when you push it up, it goes off.
Saw that.
When you pull it down, it comes on.
That's cool.
You do not have to change the switch unless you're up and you want to just, well, apparently that doesn't even come on. So you don't need to bother the switch.
Cool.
There is an internal water supply.
Yep.
So what you don't do is you don't force it. You just, a lot of times when you've got pressure going, this will have a tendency to pop,
Yep.
and
There it is.
you can hear it. So you push up and then turn, and
Yep.
there's a slot right there.
Yep. Can see that.
So you should make sure your water is full every
Yep.
morning, and that'll probably get you through the day.
And good point. Don't need too much force because if you over force it, it will disconnect the water water connection and it will
And
leak.
you'll break something up in
Exactly.
here, and then,
Yeah.
then we have to have a repair person come, and
Yeah.
you're without your chair.
Yep.
So let's talk about the doctor's side. There is a slow speed. Well, actually, this is for hygiene, slow speed.
Perfect.
There will be another slow speed right here, and then the handpiece just pops on and off.
Cool.
So then the electric handpiece is right here. It's
Perfect.
a fiber optic, so there's
Perfect.
a light that comes through that.
And would there be any reason to use that fiber optics over just the high speed or slow speed? Is there any
Fiber
logic?
optics always comes on.
Cool.
Yeah.
Cool.
And your air water syringe, and just obviously push the button there.
Yep.
The air should be dry, so if you have a problem with the air getting wet, then we've got an O-ring problem. It can
Yeah.
be corrected, or the valves are broken. So if these would stick, then we have a problem that we can take care of.
Yep.
And our in-house handyman can do that for you.
Perfect. Perfect.
So there's presets here. What we'll do is we'll let you set those yourself. And so you'll want to set it, have a return just to set up.
Yep.
There are overrides where you can just push it back, forward, up, down. This is activated, so you just push your button and you can control it there.
Perfect.
Another thing to remember though, that the high speed, the electric high speed has different settings, and that will change the RPMs.
Cool.
So you can override that a little bit or take it down. You can reverse it. So if it's red, it's reversed. You'll leave it green
Yep.
99.9% of the time. So probably this is 3,000 RPMs. That's 20. So this is probably where you're going to run most of the time on your
Perfect.
normal running.
And I can see at the base of the chair that is lit up green, so we know there's power to the chair. That's the first thing to look for. If there's no
Right,
green
if
power,
the chair
you're
doesn't
not-
work,
Yep.
then you got to do that.
Yep.
This is your on button.
Perfect.
So you got to flip that on, and then
Yep.
you have fiber optics in there.
Perfect.
I don't know if you can tell here. You can't tell the difference in the RPMs because you don't have the handpiece on.
Yep.
This is a switch just to kind of blow things out of the lines. So you don't really use that.
No.
This is what you're going to be dealing with.
Cool.
Your water, the amount of water you come, you turn them clockwise to increase, counterclockwise to decrease.
Perfect.
So you can play around with that as to how much water spray you want.
Yep.
coming out.
Perfect.
And the rheostat's here. You push the toggle switch towards the blue. That turns the water on for the handpiece.
Cool.
You push it the other way, the water's turned off.
Nice.
The dental assistant has to keep this area clean, has to keep the
Trap clean.
trap clean.
Yes.
So that trap comes in and out.
Yep.
Very easy to clean. That has to be done every day
Yep.
and after every surgery.
Yep.
And the lines must be cleaned after every surgery.
Yep.
So you'll just have your bucket full of solution. You
Yep.
put this down in it.
Yep.
These can be lubricated. The valves can be lubricated. There's a silicone gel that we have that you can put in there. You can see there's an O-ring here. Sometimes those get damaged and have to be replaced.
Yep.
You just snap them in. If you don't lubricate these will be extremely hard to remove. They'll corrode, and then we're back to having a maintenance problem.
Yep.
So those need to be cleaned out every day and lubricated. We have the same for the aspirator tips for hygiene, which you will seldom use. And sometimes there's a basket that goes in there. It doesn't have one in here at this particular time. So that's how you control it. So everything you do to lay that chair back, it's pre-programmed, and you just push the button from this side.
Beautiful. All right, folks, comment below with any questions, but thank you, Dr. Ladd, for the forest chair overview.
Right.
Cool. Stay tuned for more.